Hello Dallas Fire Rescue family. This is the next session in our videos for this COVID-19 season. The city of Dallas is planning to reopen businesses. This quite possibly could cause a spike in COVID-19 cases in our area. It's imperative that we continue to do the things we're doing to keep ourselves safe. Cleaning and disinfecting our rescues are commonplace. As we go on with this virus, it's important that we not only disinfect our rescues, but all of our apparatuses. It's very important to disinfect our electronic equipment, but to do it correctly to make sure we don't damage them because they are very expensive. During this COVID-19 season, it's important that you and I wear our PPE while we're out on incidents, as well as around the work locations. Social distancing now should be commonplace. This is done not only to keep you safe and your coworkers safe, but to try and alleviate you taking this virus home to your families. I'd like to remind you, these videos do count towards your annual CE. We created these videos to not only help give you a sense of what's going on in the department, but to allow you to see how we're working diligently to keep you safe. As always, stay safe, and I'll see you soon.
In Texas, we have slowed the progress of the COVID virus, but we, as leaders and healthcare providers, must continue to be vigilant to avoid a spike in return to isolation protocols. We can do this by adhering to our COVID policies: disinfect our environment, wear masks at all times, maintain social distancing, and reduce cross-contamination. Primarily, this video will cover daily procedures for the routine cleaning and disinfecting of departmental SUVs and heavy apparatus. We will also review information from the previous rescue decon training video for exposure decontamination. It's important to remember the difference between disinfecting and decontamination. Disinfecting is the routine cleaning of high-touch surfaces to avoid incidental cross-contamination and requires a simple mask and gloves. When an exposure is suspected or confirmed, full decontamination procedures will be followed. This is an aggressive procedure that requires full PPE and is more thorough. Finally, we will talk about contamination reduction techniques and keeping yourself clean below the knee, which will help you not create cross-contamination in the first place. Daily disinfecting should occur immediately upon arrival for your shift. During this pandemic, we should routinely disinfect all our apparatus just like our rescues. Full PPE is only needed if you're decontaminating from an exposure. However, you do need to continue to wear your cloth mask or disposable surgical mask along with a pair of EMS gloves. As always, maintain social distancing while cleaning and minimize the number of individuals inside the cab at any given time. When cleaning any vehicle or apparatus, use Spirit 2 disinfectant detergent and/or 70% alcohol, which are the approved germicidal cleansers provided by the department. Be sure to allow time for the product to do its job. Generally, 10 minutes is the recommended time for each of these products to saturate before effective disinfection has occurred. Begin with the outside door handles. These are possibly the most frequently touched item on the vehicle. Wipe every exterior handle and touch point, including trunk and side door latches when applicable. Wipe the seat and let it dry before you move into the cab. You can spray fabric seats with 70% alcohol and wipe vinyl seats with Spirit 2. Once inside, pay close attention to locations where frequent contact occurs, like seat belts, buckles, audio knobs, and shift levers. Wipe down every hard surface and spray fabric areas with 70% alcohol. For drivers, pay close attention to the steering wheel, turn signal, control terminal, master switches, and transmission control buttons. Be sure to turn the master switch off and wipe it with a rag with alcohol on it. Also, never spray cleaners directly on electrical components. Instead, spray the cleaner on a clean, dry cloth and wipe the components down. Aerosolized cleaners can be forced into electrical components under pressure and cause damage. Wipe every surface in the cab. Once that is done, every loose item in the apparatus needs to be cleaned as well. This includes map books, pens, keys, small tools, punches, and other loose items. In short, if it's in the apparatus, wipe it down with a disinfecting cleaner. Carefully disinfect your SCBA and other tools that are shared. This includes flashlights, voice amplifiers, helmet tags, and other items. In regard to the SCBA units, there will be a separate video tutorial displaying the proper disinfecting procedure. Cross-contamination can be minimized by limiting access to items. Officers may consider designating specific items to be used only by specific individuals, like the MAPSCO or apartment books. Most fire department vehicles have a lot of electronics in them. Before COVID-19, manufacturers were reluctant to approve the use of disinfecting cleaners because of concerns about damaging the device. However, this crisis has forced them to develop some best practice recommendations that are fairly universal. The cardinal rule for electronics is never spray cleaners on them directly. All cleaners should be sprayed onto a rag and then wiped on the device. This keeps the cleaner on the surface and not forced into areas that could cause damage. It's also best to turn electronic devices off before applying any cleaner and unplug them when applicable. Now, we will discuss procedures specific to each device. To disinfect the GTAC laptops, begin by powering it down. Next, close all port covers and doors to prevent the solution from entering sensitive connections. Use the 70% alcohol solution that can be ordered through Clothing & Supply in a clean, dry cloth. Do not use paper-based materials such as paper towels, tissues, or toilet paper. Moderately saturate the cloth and thoroughly wipe down the laptop. Pay extra attention to screw holes, ridged areas, strips, and finger touch points. Although the GTAC is considered water resistant, it is not waterproof. Again, do not spray anything directly onto the screen, water vents, or the keyboard. Ensure that the laptop is completely dry before you turn it back on. Cleaning the iPad is similar. Start by unplugging it and powering it off. Use a clean, lint-free cloth that has been lightly sprayed with 70% alcohol solution. Wipe the tablet down completely and allow it to dry. Do not use any abrasive materials on the screen as it could cause damage and diminish the screen resolution. Once it is completely dry, power it up and it's ready for use. Handheld radios can be cleaned with soap and water for general cleaning. This procedure is contained in the second video attached to this module. To disinfect, use 70% alcohol and a cloth. As with other electronics, power it off before cleaning and do not spray any liquids directly onto the device. When it is completely dry, it can be powered on and returned to service. Do not use bleach or any other harsh chemicals as this can damage the plastic components. The Apparatus cell phone can be washed and rinsed with water. However, it should be disinfected with the same 70% alcohol solution. As with other devices, remove it from its charging cord, power it off, and wipe it down. Do not turn it back on until it's completely dry. Dashboard control switches, apparatus radio, and other embedded electronics should be cleaned and disinfected using the same process just described. Again, do not spray or squirt cleaners directly onto the device. An aerosol disinfectant, such as Lysol, may be used as a final spray down of the entire area. However, Lysol is not to be used in place of germicidal detergent. As always, do not spray Lysol directly onto an electronic. As a reminder, a full decontamination after an exposure requires members to don full PPE. Please refer to the DFR training video, Rescue Decon, for a full explanation of complete decon procedures. Once in full PPE, follow the same routine cleaning procedures. Remember that before wiping off any objects or area, that you allow the Spirit 2 spray or alcohol solution to sit for a minimum of 3 minutes for bloodborne pathogens or 10 minutes for viral exposures. If you use a mop head, be careful about cross-contamination. Either dispose of the mop head, keep it soaking in disinfecting solution, or designate a mop that is used solely for that purpose. One important way to reduce exposure is to control cross-contamination. but we often forget about our feet. Let's run through a few things to consider as reminders of this threat. First, let's review information covered in the Hazmat Decon video from a couple weeks ago. Officers should consider marking off a spot on the apparatus floor that delineates a clean and dirty zone. As previously mentioned, it makes sense to doff the shoes you wore on the emergency call and wear clean shoes in the station. This is a simple way to avoid having to clean your shoes after every run. If a second pair of shoes isn't a workable solution, members should consider disinfecting their shoe soles after each run where the public or a public space was encountered. This can be done on the approach with a soapy brush or by spraying them with Spirit 2 disinfectant. In summary, keeping your apparatus clean from cross-contamination and routinely disinfecting it at least once a shift will reduce the occurrence of exposure and be one more step in protecting ourselves against the threat. We ask our leaders to continue to take all reasonable measure to protect the members under their care. Let's continue to do what we do and do it as safely as possible. Thank you and stay safe.